So first, let me present our first keynote speaker. It's really a privilege because she helped us to get started on this whole movement. Kelly Pfeifer is the Deputy Director for Behavioral Health for the California Department of Healthcare Services. Dr. Pfeifer was appointed by Governor Newsom in July 2019 to lead the newly reorganized Behavioral Health Division of the California Department of Healthcare Services. She practiced family medicine and is a former medical director of the San Francisco Health Plan and several health centers. And prior to joining the state, she'd been the director of high-value care at California Healthcare Foundation. While there, she received the highest award presented annually by the California Department of Public Health to an individual exhibiting outstanding leadership for her work leading the California Healthcare Foundation's opioid initiative to end overdose deaths in California. So, with that, let me introduce Dr. Kelly Pfeifer.
Thank you. Good morning. It's an honor to be here, and I have to start by a frank admission, which is I spent the first 5 years of my career fueling the opioid epidemic and the rest of it trying to end it. And like many of my generation, I'm a family doctor who was duped. I'm not in big pharma. I just believed the promise that opioid pills would help people and make them better. And of course, the opioids held great promise. People got better for a little bit, and then they always got worse. And like many of my generation, I saw patients become dependent on pills that they couldn't stop taking and ultimately end up with addiction. And I also got a call from a coroner one day, which made me wake up and realize I have to practice differently. Because we've learned some really hard lessons, that the brain can't tell the difference between high-dose OxyContin and heroin shot in a vein. What opioids do is they flood the brain with dopamine, and dopamine is the chemical in our brain that manages our reward system. We get flooded with dopamine when we have sex, when we eat, when we drink, when we're happy, and our dopamine levels plummet when we do things like isolate that put us into despair. So dopamine is really a survival chemical. And our brains are very fine-tuned to stay in this very, very narrow range. So when our brain gets flooded with dopamine, again, because whether it's from a pill taken, like your doctor said, the brain says, never again. We're going to ratchet down that response. We're going to be unable to make dopamine, kill off receptor cells. So your brain, over time, doesn't work the way it does before. And sometimes those changes are permanent. So you'll find people with long-term opioid use, again, whether taken by the doctor or taken from the street, have to get opioids every day just to function, just to get up to that level of dopamine that for the rest of us feels like kind of a bad day. That's what they're doing over and over and over just to stay alive. And so what we've seen is, as we've learned more about brain chemistry, we've learned how to treat this epidemic very differently. So there are solutions for how to get us from where we are to where we need to be, but it's not the path we've taken. And so doctors like myself, healthcare system has to admit, we made mistakes and we need to do different things differently. We can't pretend that there's anywhere near enough addiction specialists to treat people who are addicted to opioids or addicted to methamphetamine or addicted to marijuana. We in the healthcare system have to acknowledge that if addiction is a brain disease, and we've learned it is, then we in the practice of healthcare have to learn how to manage it, and not by ourselves, but with a community around us. And I would challenge my colleagues in law enforcement to admit that same mistake, that we've spent $1 trillion on the war on drugs, which led to mass incarceration of people of color who we know painfully are more likely to be arrested, get longer sentences, denied parole and probation for the same but often lesser drug crimes than white people. And our drug problem is nowhere near solved, and we can't pretend that people aren't dying of overdose in our jails and prisons. So we have to think differently. But fortunately, there are places that have cracked this nut, and we have seen overdose rates in some places drop by 80%. But it's not in this country. It's in places like France, where they've made treatment easier to get than street drugs, and doctors like myself can prescribe buprenorphine, get paid by insurance companies to treat addiction, not have to go through special waiver training, and they dropped heroin deaths by 80%. We've seen other countries that have worked really hard to make sure at every single touch point of law enforcement, people are pushed to treatment instead of jail. It costs less, people get better, people do recover. So I would challenge us on this day to hold ourselves to data and science. There are things that we know work. There's hundreds of things you could do to try and stop this epidemic. I would challenge us, there's 4 things that we really know how work, and we should work on them. So first, for people who have chronic pain, who are dependent on opioids, we can't just go back and say, oops, we made a mistake, we're cutting you off, I would just learn they don't work. Because when we do that, we put them in the hospital and often they die. Half the people cut off from opioids end up in the hospital and many overdose. If we're gonna help them, we have to take care of them. Second and key is we have to make treatment easily accessible at all touch points in our systems. In California, we call that treatment starts here. If you see your primary care doctor and you admit to a problem, we're training primary care doctors to be able to prescribe buprenorphine, to work with substance use specialists to be able to manage the more complex cases. Treatment starts here. If you show up in now 50 of California emergency rooms, you can get a dose of buprenorphine and a substance use navigator to help you get into treatment. Treatment starts here. I'm so proud that in our prison system, we have made the commitment in every prison in California to make all substance use disorder treatments available that are evidence-based, and that includes buprenorphine, methadone, naltrexone, behavioral treatment. We're equipping our prisons to make sure that people don't overdose and die when they walk out the door. We're doing the same thing in our jail system. It's hard, slow work, but again, treatment starts here. Third, we need to embrace this concept of harm reduction, which I like to call treating people like human beings. Like, for example, how many of you have set a New Year's resolution? I'm gonna eat better, I'm gonna exercise more. Hold your hand up. And now keep your hand up if you kept that resolution every single day for 365 days without fail. Right? I mean, that's just human nature. We are not perfect, yet we expect people with drug addiction to be perfect. So imagine a culture where we said to people, we want to take you where you are, come in, we'll help you. If you're not ready to quit, we'll give you clean needles, we'll make sure you don't get HIV, we will give you a warm place so that when you are ready to quit, we'll help you. Because what do we know about smoking, right? It takes 50 times to quit before you're ready to quit for good, and people relapse. That's the nature of addiction. Imagine a culture where we didn't take your kid away if you made a mistake, where you didn't go back and lose your freedom, where you didn't lose your job, where we embrace the fact that we're all human and we are all on a journey. So all of these changes, how doctors prescribe, how law enforcement treat addiction, are big culture changes. And this is what this day is about. The fourth thing that we need to do is we need to change our culture, and we can't do it alone. And that's where there's the power of coalitions and the power of the coalition network. So I want to tell you a little story. In 2015, when I was at the foundation and I was looking around saying, how do we do this? This is really hard, because people don't change because some state official told them they have to do something differently. They don't change because the AMA changed their guidelines or because the Attorney General said you need to do so. It's culture and it's local, and you change because the people you work with and the people you care about are all changing, and we change together. And the only way to do that is by engaging local leadership. So we said, look what happened in San Diego and Marin, which you'll learn about today. They brought people around the table, they put data on the table. This is our overdose rate. They created a call to action. They said, we can't fix this, doctors alone, or law enforcement alone, or addiction treatment alone, or advocates. We have to sit around and do it together. And they didn't sit around and processing. They created goals and action, and they said, in 12 months, this is what we want to see. And it was powerful. So our foundation gave seed monies to about a dozen of these, and it grew and grew and grew. And I made a mistake, I admit, as a doctor. I just thought, people just need to know what to do. So we'll just tell them what to do, and it'll happen. And I will say a lot happened with us just focusing on, this is how you treat drug addiction, this is how you treat pain, this is what harm reduction is about. But people stalled, and what we learned is that any culture change requires strong leadership, and it requires the ability to communicate with people you don't know how to talk to, like you're not used to talking to. It requires the ability to admit you're wrong and say, I may not have all the answers. So we turned to the Center for Health Leadership and Practice at the Public Health Institute, and we said, help us, because healthy coalitions that get stuff done are healthy organizations. Healthy organizations need to learn the basics. How do you run a good meeting? How do you talk with people who don't understand how you work? And that was really powerful. And of course, the doctors were the worst. They were the ones in the coalition says, yeah, that's processing, because we don't like to talk about stuff. We just want to get stuff done. I think law enforcement's the same. But almost all those coalitions eventually came back and said, oh, you know that stuff about like process and capacity building and how to work together? But I think we need that. I think we're stuck. So this has been a force to be reckoned with. What's happened in California with all these coalitions in places that are like different countries. LA is very different than Trinity County, than Plumas County, but they've all come together, they've learned from each other, and we're really excited about leveraging what we've done, where we have red counties and blue counties, and we're all losing our children, and we're all working together to solve this. So I have great hope for a national network. This type of work of learning from each other and learning not just what to do, but how to do it, and how to create culture change that sticks, it worked. We have an incredible opportunity nationally, both from you to learn from what we did in California, but even more importantly, for us to learn from you. So thank you for joining us today.